Hello everyone. Today's presentation is about a journey through dialysis, accessing effectiveness and limitations. So we'll be discussing about chronic kidney diseases, which is a widespread and dangerous condition in kidney. In this presentation, we will explore the effectiveness of dialysis system as a treatment option for CDK and the long-term management challenges that come with it. So let's begin. In this slide, we'll be looking into the overview of chronic kidney diseases. So over 37 million people around the world have these diseases. So what causes these diseases? Diabetes, hypertension, cystic kidney diseases, and many other diseases cause chronic kidney diseases. So there are basically five stages based on GFR, which is known as glomerular filtration rate, from mild kidney damage to kidney failure. So let's move to the next slide and see. In this slide, we'll be looking into dialysis as a treatment option. So dialysis is basically a treatment which purifies the blood flowing through the kidney, and it is used to maintain the composure of our body. So there are three types of treatment options. These are hemodialysis, peritoneal dialysis, and the last one is advanced stage of dialysis. So let's look into each one by one. The first one is hemodialysis. In hemodialysis, blood is filtered to the artificial kidney machine outside the body for 3 to 4 hours with 3 to 4 times per week. So let's move to the next one. A catheter is inserted into the peritoneal cavity and a special fluid is used to clean the blood inside the body. So let's see the last one of this treatment option, advanced stage of dialysis. A treatment option to compensate for the loss of kidney function for people at end stage CKD or kidney failure. So let's move to the next slide. In this slide, we'll be looking to the assessment of dialysis effectiveness. There are major components to analyze this. These are patient outcome, quality of life, and complications and side effects. The first one is patient outcomes. Dialysis can improve patients' overall health and increase their lifespan and chances for survival. Quality of life. Patients may experience improved energy levels, less fatigue, and reduced stress from dialysis. So let's look into the last one. This is complications and side effects. Some of the common side effects are infection, low blood pressure, and anemia, and fatigue. So these are the assessments of dialysis effectiveness. In this slide, we'll be looking on to the assessment of dialysis limitations. There are three major limitations for dialysis. These are challenges in long-term management, risk and complications, cost and access to treatment. So let's look into them one by one. The first one is challenges in long-term management. Dialysis requires a long-term commitment, lifestyle changes, and strict dietary control. As this is related to kidney, we need to maintain a dietary system, and lifestyle changes are required for this treatment. So let's look into on to the next one, risk and complications. Prolonged dialysis may result in complications such as infection, vascular issues, and reduced quality of life. So let's look into the last limitations of this dialysis, which is cost and access to treatment. Dialysis is an expensive and often limited to wealthier nations and patients with health coverage. So this treatment is not available for everyone at this moment. So in this slide, we'll be looking at the comparison of dialysis to other treatment options for chronic kidney diseases. There are other treatment disease options for CKD. These are kidney transplant, home hemodialysis, nutritional and drug therapies. So let's look into them one by one and see if these are better treatment options than dialysis. So the first one is kidney transplant. It is a surgical procedure to replace a diseased kidney with a healthy kidney from a donor. It offers more effective and cost-effective option than dialysis. So let's now move on to the next one. Home hemodialysis. So in this process treatment, patient's training is required to dialyze at home using a machine. It can increase the patient's independency and reduce complications. So let's see the last one, nutrition and drug therapies. In this treatment, we need to modify the patient's diet to control CKD symptoms and slow down the progression of this disease. This treatment can be combined with other treatment options like dialysis. So If we compare this treatment option to dialysis, I said kidney transplant is the best treatment option for this, as dialysis is only a temporary solution for kidney disease, not a permanent cure, and it is more costlier than kidney transplant. So let's move on to the next. In this slide, we are going to discuss the future of dialysis and CKD treatment. Regenerative medicine, nanotechnology, and wearable devices, artificial intelligence, and precision medicine. So let's look into the one by one. Regenerative medicine. Stem cells and tissue engineering technology aim to develop new kidneys or repair damaged ones. The next one is nanotechnology and wearable devices. Continuous monitoring of indicators such as creatine, urea, and other vital signals can help to manage KCD. As many wearable devices such as smartwatches are already introduced where we can measure our heart rate and many other functions of our body. So let's see the last one, artificial intelligence and precision medicine. Predicting and managing CKD complications by studying large amount of data. So let's move to the last slide. And so in this slide, I'm going to give you conclusion and recommendations for dialysis as a treatment option. So there are three things to consider. These are factors to consider, recommendations and solutions, the future of dialysis treatment. Let's look into them one by one. Factors to consider: effectiveness, patient's preference, long-term management challenge, cost of treatment must be considered. The next one is recommendations and solutions. Promoting alternative treatment options, facilitating access to quality care, and subsidizing dialysis treatment where necessary. So, what does the future of dialysis treatment hold? The future looks hopeful for improved CKD treatment with more innovative approaches to the technology emerging. Thank you everyone for watching this video. I hope you have a good day.